Greetings everyone, this is Timothy, the Digital Apothecary, and I'm back. So it's been a rough few months, I'm sure, for many of you. And I mean, I don't even know where to start. And for me personally, it's been a rough past few months. It's probably the biggest thing has been I had my second child during this pandemic. And so we had a pandemic baby, and she's now 3 months old. Finally sleeping a little bit better, and that's why I'm now back to making videos. And I actually stopped making videos early back in January just because things were getting rough, especially with teaching and such. And I'll probably talk about that another time. What's it like to be a professor during this whole situation? There's a lot of stuff to learn, to be quite frank. But for now, I'd like to catch up on where am I with the Digital Apothecary, what am I trying to do, and where I'm supposed to go in the near future. So, to jump right into this, one thing you probably noticed is I have a new screen that I'm using, and this is basically or MMHMM, and it's quite an interesting platform. I got into the beta and now testing it out, and it's been really fun just because I think it's much more virtual. You can see yourself and you can do lectures and presentations on it. That's what I'm going to be trying out. Now, I'm going to try doing a green screen here soon, seeing what that's like, so that might come up in a future video. But one thing I want to focus on now is just talk about a few things I've been writing about on the Digital Apothecary, which hasn't been very much. I'm hoping after things settle down here I can get back into this a little bit more seriously. But to start off with, I wrote an article about what's it like to have a child in a pandemic, and this was me just kind of like putting out there just the whole experience. It was difficult trying to get all supplies and everything with shortages going into the whole situation, and just nerve-wracking about being in a hospital in the middle of the pandemic. For some of you guys know that I'm up in the Northeast, and we were in the middle of the surge when my daughter was born. It was probably the hardest part wasn't to the birth. The hardest part was probably just thinking, being in the hospital room and not being able to leave it after the birth, and no one coming to visit you, no one coming to see you, no friends, no family. And there's staffing was short, and it was very lonely. We were very happy to get out of the hospital. That was a big thing, and I would say that was probably the hardest part of the whole situation. And it's still a little tough because it's like being at home and no one's coming to visit. Also having a toddler at home full time as well, so it's definitely was an interesting experience to say the least. So if you're very interested about that, feel free to give this a read. Followed by one thing I spent some time writing about was, what happens after COVID-19. And this is something that I'm really, really interested in, because if I think about, where pharmacy is going to go in terms of after this whole thing, what do we turn into? And there are some areas I focused on, and some things I think that are quite interesting is, so one of my areas was I think that there's going to be a huge pivot for a lot of businesses. Like I talked about CVS Health Hub in the past and such, and probably the biggest thing for me has always been, there's a focus on going back towards businesses themselves. And I don't know if that's going to be the case now. I think remote's going to be a really big thing. I think we're going to see more remote testing. I think there's going to be more telehealth services, because I think once people get a taste for it, they're going to want to do it. It's going to be down to the payers at the end of the day to really dedicate, is this going to be what the future is? But I think that's going to be something that's just going to have to be watched out for. And I think a lot of pharmacies have to keep this in mind, the independents and the chains. Next would probably be the vaccinations. Oh my word, this has been such a hubbub. So for those of you that have been watching it, like you see, the whole ruling that pharmacists can now vaccinate 3-year-olds and above, and the fact that the AMA, the APA all came after, and everyone's hubbub about it. I don't blame them, because we're going to be cutting into their business at the end of the day. That's going to be it. Hopefully, if you look back at the whole vaccination thing in the past, the whole premise was that pharmacists would be able to vaccinate more people. So if you had like a slice of a pie, the pie got bigger. the reality was also we ate into that pie. And I haven't seen any data, but I'd be very curious to see how much of that pie was removed from, many providers and focused more on the pharmacies, especially because the overhead cost is probably a lot lower. The billing is different, scalability, so the payers like it, but something to consider. So here, it's gonna be quite interesting because even for like training pharmacists to vaccinate, like if you follow it, like it's basically do one IM, one sub Q for the APHA certificate model. For students, they do it on like a partner, but we never really practice on children, so I imagine it's gonna be a tough situation for many people trying to do it. It's gonna be a learning curve, but I think once a COVID vaccine comes out, that's going to be the big push. I think that's where you see the pharmacists getting really a large ingress into that population. And that really takes me to this. And this is going to lead into another article I just wrote recently, which was basically, I think the clinical services, we really have to figure out here now, do we fit into remote patient monitoring? Do we fit into other chronic disease management? We see Livongo and Teladoc team up into Teledongo. I like Lividoc better. I think that sounds much better. But Teledongo is what's going to stick with. Where do we fit into this whole premise? Because one thing that gets me is there were some studies that came out, and two of them I think, were really good. But the one that I'm going to highlight is there was a Deloitte had this whole vision of the future of the pharmacist and pharmacy. And my God, I wish people would stop this, because pharmacy and pharmacists are not synonymous with each other. They're two different things. So I would advocate and say that you can have a pharmacy without a pharmacist. I think that's where we're kind of moving at this point, especially with expanded tech abilities, remote capabilities, just the whole thing. Like legally, you can't get rid of the pharmacist for verification, but that doesn't mean they can't do that off-site and have a technician fill prescriptions and verify that that's what's being dispensed out. The prescription itself, coming from a physician being checked, it has to be done by a pharmacist, at least currently right now. But beyond that, that's something that I think could be out there. And Deloitte talked about this whole idea, like 3D printing of medications in pharmacy and pharmacists overseeing it. I'm not too sure if even these people who wrote it have a huge background in pharmacists themselves, or even talked to any pharmacists making this whole idea that you could use AR contact lenses worn by a pharmacy technician to verify medications. Okay. I mean, there's other technology out there I've seen. Like, we already have stuff you can put on the table and a camera, and you can just throw pills on it and identify it. There's been Nature publications out on it. I don't know if you need a whole AR augmented contacts there. And I've talked about Google Glass and other things like that. You could do some interesting things with this, but I don't know. And so they focus on a bunch of things. I think it's an interesting read. I would read it. It might jive with you. I feel like it's a paper that's really far out and doesn't address the current issues now at the end of the day that we need to face to maintain relevancy. And that's still something I'm struggling with, and that's something that I'm trying to figure out myself. And then the one thing that got big, and I think this goes and reaffirms this whole premise, is that JAMA put out a paper, and it was done by pharmacists, I think, out in University of Pittsburgh. I liked the paper. It was really well written. And they were basically looking at, I think, Medicare data and PCP data. And what they were looking at was just, who and where do they visit. And Dr. Baron Brock and colleagues looked at this. I think the thing that really stood out to me was the fact that, the patients visit a pharmacy more often than they see their PCPs. That's the bottom line. This is not including mail order or other things, though, that you would probably, kind of divvy up the information. But if we take into the fact that there's multiple health deserts in the United States, multiple food deserts as well creeping in, pharmacies still serve as that hub for health. That being the case, there is an issue of pharmacy deserts now being created, and to me, that's going to be another big issue. That's going to be in the future we have to address, especially when we see some chains closing stores after they beat out the independents and there's nothing left in the community, which is unfortunate. So, but the big thing you have to make a point here is just because a person visits a pharmacy doesn't mean they see a pharmacist. odds are, when you think about it, like a patient walks into the store or gets their medication, they get it from a pharmacy technician, and I'm sure you've all seen this. You go, you get medication? Do you have to sign off on anything? No. Okay, walk out. Doesn't even talk to a pharmacist unless they have a question. They may not even be pinged for it at the end. So the authors do a good job here, and I'm going to read it out. It is important to note that pharmacists cannot capitalize on accessible and frequent encounters at community pharmacies without further practice change and transformation. The need to recognize pharmacists as providers of billable services, integrate pharmacists in emerging delivery and payment models, and enhance collaborative relationships. To further capitalize on the uniqueness of the pharmacist as an accessible healthcare professional, pharmacy and healthcare organizations must consider how community pharmacy practice will adapt to transform pharmacist roles, including changes to business models, workflows, and staffing. Now, this is obviously all published pre-COVID, and my questions about what COVID is going to do to pharmacy, I think, is highly relevant to it's even this, because I think it puts even more pressure on us at the end of the day. But this is something that we're going to have to figure out. I mean, I think the authors did a really, really, really interesting job here, and they really demonstrate that a pharmacy can serve as a definite hub. And with the COVID vaccinations coming out, that's going to fill that role, I think, generally in the United States. We need to somehow capitalize into that to reinforce that pharmacists can be a clinical practitioner in these services and provide more, care. Mid-level or mid-stakes conditions, I think, are probably highly plausible. But then I also look at these startups and the companies that are coming out there that are really getting into them, and I think that's going to be very difficult to beat those out at some point. I would love to see the data coming out from like Roe, Hims, Hers, New RX. Do they see an uptake in business during this? That's going to be really key here, because that just demonstrates that patients readily found this stuff and went towards it. You see other companies and startups like TruePill really opening up the API and focusing on this. It's definitely going to be something that's going to be a big battleground, I'd say, here soon. But there's definitely something for us to consider. So yeah, those were some things I put out recently if you guys want to give it a read. I'm hoping to get back in here and talking about different things. Some projects I'm working on is I'm updating my list of direct-to-consumer prescription companies here, and I'm also updating my list of startups in the pharmacy space that I think are high and big disruptors, and I want to spend a long time talking about that, so I'll probably be putting videos out there. And I welcome any thoughts if you have comments or if you have interest in what you'd like to hear me talk about more, especially, what this post-COVID pharmacy environment is going to look like. But really, I thank you for your time, and thanks for listening, and have a good day.